class, how's it going? My name's Hector Rivera. Today I wanted to talk to you guys a little bit about the legal research that I did in terms of both maintaining and running an efficient physical therapy clinic. The professional physical therapy has a lot of different settings. The one that I'm going to be talking to you guys specifically is what's called an outpatient clinic or a private practice. By the definition set by the American Physical Therapy Association, this is a common physical therapy setting. Individuals visit the setting, clinic, office, or healthcare facility primarily to address musculoskeletal, orthopedic, or neuromuscular injuries or impairments. I worked as a physical therapy aide for about 2 years. In my description, it'd be a place where it's a lot more open because your patients are coming to see you as opposed to a hospital setting where they're normally tied to a bed or post-operative. It's a lot of weekend warriors or people coming back from surgeries. There's a lot of plinths so that physical therapists can work on patients through manual therapy, but a lot of open space so that they can either use weights or go through balance exercises, but a lot of therapeutic exercises going on all simultaneously. So really making sure that you're aware of your settings and your environment is key to the success of the clinic in the setting. In terms of risk management, I just want to jump right into it. First case I wanted to talk about was Dalmau against Metro Sports Physical Therapy. This is from 2014. This is an example of what the American Physical Therapy Association calls a claim that's due to failure of supervising or monitoring. Here, the patient was seen by a licensed physical therapist. During follow-up treatments, the patient care was transitioned to a physical therapy assistant. And although the terms sound very similar, the scope as to what they can do does change between the professions. So what the physical therapy assistant decided to do was add in an exercise that caused re-injury and a permanent deformity in the patient's bicep tendon, bicep muscle. With this, they said that they ran everything by their physical therapist, but there was no documentation of this. The recommendation going through a bunch of literature in terms of solving this risk management issue is really training your staff and letting them know of their requirements and their services, what they're allowed to do in the scope of their professions, but most importantly, having documentations and a paper trail for everything. Both good or bad, it's very important to document everything that's happening. So if there's a major improvement, we can always go back and look to see what it is to replicate and help other people. And if there's something bad that happens from a legal perspective, the documentation is really going to show that you've done everything that you were supposed to do in terms of helping your patient to make sure that the clinic and the business and you as a professional clinician are protected in terms of your patient care and your standard of care. Next, I want to talk about LeClaire versus Suburban Hospital. Here it's an example of what's called improper performance of a therapeutic exercise. The patient had come into the clinic. They were an elderly patient with a lower extremity injury, so they had balance issues coming in. When they were in the clinic, they were asked to do an exercise on their own, so a little unsupervised. With that failure of direct supervision, they fell and re-injured themselves. So the recommendation here from the American Physical Therapy Association is really to stay close enough to your patient in the chance that they fall, that you're able to catch them. You give them something to hold on to, so stabilize a hand railing or some kind of support if they need it. And in some cases, you're using a gait belt, so a belt that wraps around their waist where you're holding them up and you've become their support. So at no point is somebody with balance issues or the elderly in this situation, or if they're, both in one, allowed to walk around, freely if they're not comfortable doing it on their day-to-day basis. If they're coming to you with these issues, you have to be their line of support and you have to protect them while they're in your care. Third, I wanted to talk about Sensky versus Madison Avenue Physical Therapy. And here it's an improper management of the core treatment. The patient came in post-operative, so they had just had a surgery on their lower extremity. From the get-go, they were asked to press 50% of their weight with that injured leg. It ended up being a little too much weight for the patient to start off with, and they injured themselves again. So they kind of re-injured the post-operative treatment that they were working on. Again, in similar cases, to avoid injury, it's a recommendation of staying close to your patient, giving them a means to lower the resistance either by handrails or just not starting them with that much with that much initial resistance. But the biggest thing here is to consult a clinician, their referring physician. The referring physician knows a lot more about the details of surgeries and what brought them to seek care in the first place. They have a whole picture, and they're the ones that are setting up that plan of care. So yes, the physical therapist does have the experience to try and aid their patients and get them back to the place where they feel comfortable living their lives. but they have to have that constant communication with the physician because they are the ones that have the whole picture. And combining both of those minds, that's how you the best care for your patients. Where if you ignore what the physician is asking for, you leave yourself open to liability, again, at a business level. Next, I want to talk about employment law. Here, I want to talk about Apex Physical Therapy versus Ball. It's 2018. Advanced Physical Therapy was made up by Zachary Ball and Tal Dinneberger. They were both employed by Apex Physical Therapy, and when there, they signed a contract that included a confidentiality clause and a non-referral clause. The confidentiality clause was not valid in the eyes of the court because it was unenforceable due to pretty much taking all of their experience away that they learned at Apex Physical Therapy. So they couldn't use any kind of pricing that they might have learned, any referrals to patients that they had worked with in the past, any policies or procedures, or anything that they learned in their time at the clinic. But the biggest thing was it wasn't enforceable because there's no end date. So in essence, anything they learned kind of halted their progress, and they were no longer able to use any of this information that wasn't deemed enforceable by the court. Kathy Lewis does a great job in terms of any kind of legal precedent going into physical therapy, making sure that every party involved is able to understand the pertinent language. So everything is clearly defined. So you have that informed consent that we talked about in class to make sure that everybody's on the same page, both employees, former and future employees, knowing what it is that the scope of their contract allows them to do and how to protect yourself if there's something that you want to make sure is proprietary to your company and only your company. Next, I have Cox versus Oasis Physical Therapy. Here, Kelly Cox is the plaintiff. She's suing for a number of different things, including sexual harassment and a hostile work environment. It starts off her seeing Dr. Shirizade, who was both her boss and her medical clinician. She was asked to undress without medical necessity and was receiving a lot of unwanted physical attention from her doctor when she was in the workplace. A lot of sexual comments. From here, and I did not include this in the slide, I apologize, but she reached out to her boss in the physical therapy setting, and they just kind of told her to brush it off, to toughen up, and it was part of the job. So the recommendation in terms of eliminating hostile work environments is establishing an employee advocate to give an employee a means of fighting back against hostile work environments. This really means giving them a chance to voice their concerns and going to somebody who's not their direct supervisor so that they don't feel any kind of retaliation might come their way just because they're speaking up against something that they don't feel is right. So setting up that employee advocate's a major way of protecting yourself as a business, but also making sure that your employees feel welcome and they want to come to work. Next, I have Serenish against Beverly Healthcare LLC. Here, the plaintiff Victoria was looking to say she was discriminated against on a basis of gender and pregnancy discrimination. Here, the Beverly Hills Healthcare LLC was very forward thinking in that they had policies set up to eliminate discrimination at any level in their clinic. And this, in the pregnancy discrimination claim, was shown because there was no visible examples that somebody who was pregnant was treated differently than anybody who was not pregnant. So keeping everybody to the same standards really helped this clinic avoid legal liability. And after, again, the governing body for physical therapists has a lot of direct publication just eliminating discrimination in any clinic whatsoever. And they also advise being proactive in terms of the policies you put in place. Here, showing pregnancy discrimination will be eliminated and any kind of discrimination is eliminated based on the policies that both the overall governing body of physical therapists is putting in place, but specifically the clinic in Beverly Healthcare, and the ways that they went forward to make sure that they eliminated any kind of issues from the inception of their company. Now, applying these things, my goal is to one day be a clinic director in an outpatient physical therapy setting, and to own my own clinic. So I want to be that first line of defense in terms of eliminating hostile work environments, understanding what it is that means, and how there's different policies and procedures you can put in place to stop that from the get-go. One of them being the employee advocate outside of your clinic. I want to be forward-thinking and avoid liability in terms of letting everybody understand the scope of what they're allowed to do in their positions and how their work affects the other people who they're working with. And specific to trademark law, something that we learned recently, I want to be able to separate myself from my competition and really create, a physical therapy setting and environment and clinic that's specific to me and the people that I hire. That's my goal one day, and I want to be able to make that, its own entity. Now, applying things that we learn from the Bible and the teachings, I have a couple verses that I want to go over very quickly. You should not be partial in judgment. You should hear the small and great alike. Shall not be intimidated by anyone, for the judgment is God's. And the case that is too hard for you, you shall bring to me, and I will hear it. Here, it's really an example of making sure that everybody feels confident to be able to reach out to you, especially as a supervisor or a boss. You're putting yourself in a place where your employees can trust you, and you're not giving judgment in any way. You're impartial because you're fair to everybody who you're working with. And from here, there are positions and people above you. If it's something that's out of your hands, understanding that, there are people to support you at every level of your career. And that's what their job is. Lead me in your truth and teach me, for you are the God of my salvation. For you I wait all day long. Here it's really just taking the teachings that we're learning. We have a gift by being in this program and learning all the things in terms of law and everything that kinesiology can give back to our patients. So understanding that, lead me to your truth and teach me. Let's seek out the legal precedent and the teachings that we have in front of us so that we can really give people that salvation, be the workers that God wants us to be. Finally, I have, and let us not grow weary of doing good, for in due season we will reap, and if we do not give up. And here it's just a matter of making sure that patient care is always going to be at the forefront. Yes, sometimes things will be difficult to think of, but if we're putting our patients first, and making sure that we're in the tenets of the law, then there's nothing that can stop us from giving back to those people and really helping them better their lives and get back to the places that they want to be. And that's our jobs as clinicians, to make sure that we're doing everything we can to improve our patients' lives. And that's the biggest thing that I'm taking from this. If there's ever a place where you feel like you're put up against, a rock and a hard place, it's really always putting your patient first. Thank you for your time. I know it was a little condensed. If you guys have any questions, feel free to reach out to me. I'm more than happy to help out, and I do have some references on the end. But yes, thank you for your time.